Let's bring in our guests. We have in the studio the Director of Disease Control and Immunization, National Primary Healthcare Development Agency, Dr. Garba Ahmed Rufai. Dr. Rufai, thank you for coming on Weekend File.
Yeah, thank you very much. Happy to be here.
All right. We saw the doctor there in Rivers State confident to say there is availability of these vaccines. But what we're hearing from the numbers and where Nigeria is ranked, you tell us, where are we?
Where are we? That's a good one to ask. But before I go into the where are we, I just want to say that, yeah, the doctor that spoke is actually correct. We have vaccines in the health facilities, public health facilities. You call them primary healthcare centers across the country. They're basically over 28,000 of them where these services, PSC services, not just immunization, maternal and child health care and growth monitoring and all of that happen. So yes, we have a program, the immunization program that has been on for over 2 decades so far. And we have what we call a national immunization schedule that prescribes how these vaccines should be given, the timing of the vaccine, and also the site of the vaccine, and when you need to repeat for vaccines that have a more than one series, like the Penta vaccine that the reporter talked about, which she called DPT, yeah, but it's not Penta, it has 5 antigens there. And these vaccines are actually there, they're free. And in recent times, our survey showed us that we have made some slight progress from the last time we had the National Demographic Health Survey in 2018 to when we now have this, the one of 2023. We showed a slight progress of 3 points. So we're from 50% now, we're at 54%. And we're looking good in terms of how we are beginning to restructure the program, how we are beginning to restructure the health system in general, not just MPACD here, but being guided by the Federal Ministry of Health under the whole SWAP arrangement. Immunization is just one part of all of the services. So we would say we have challenges, no doubt about that. However, we are working with all of our partners, our donors, our state and subnational level actors, who are also the PSC workers, so to say. We have at the state LGA and also at the settlement level where these vaccines are actually administered.
Yeah. Okay, Dr. Rufai, you just rightly put it that you have challenges because from the reports we're getting, some parents are being, reluctant as a result of fear, and you want to share with us these challenges you're contending with, because if vaccination is part of the broader perspective of universal health coverage, how do we achieve that going forward?
So immunization is not new, it's everywhere, and we're beginning to see different things even in the West. For Nigeria, our main concern is how to actually create intentional vaccine education for our populace. Beyond all of the jingles, beyond all of the billboards, we're looking at how we formally, properly engage communities using the structures that are there. We have very wide footprints in Nigeria across every settlement. You see one, maybe a health post or a primary healthcare center. It might be level 1 or level 2 or level 3, depending on the facility and the services that they provide. But another thing that we did see recently was the misinformation. Certain groups of people have decided it is their business to go about and misguide Nigerians and tell them all sorts of stories. We did see that from 2003 with the Kano incident of polio campaigns. We were able to resolve all of that. We've worked with the partners, we worked with the state, we worked with the religious and traditional leaders, we work with CBOs and CSOs to be able to correct some of these things. And yes, it's not all about misinformation though. We have people who genuinely claim that they don't know about vaccinations and they don't know when. Then you have to look at all of it.
Do you doubt that?
I
That they
wouldn't,
don't-
I wouldn't really doubt that, but I would say that is a small fragment of the population.
Okay.
Yeah, we have more people who are aware of it, however, have their reasons. Might be religious, might be social. Sometimes they're bigger. We just recently resolved the case in one of the states where we're conducting the polio campaign. We just concluded the polio campaigns where a whole community just turned us down. And by the time we got into them to engage with them, we found that their issues were different. They were talking about all of the bad roads, all of the other social factors. And yes, it's government is unwholesome. But that we at the MPACD, we're still part of government. We do our part. We make sure we provide the vaccines. We make sure we train the health workers. We make sure the vaccines actually get to those last mile where it is important. The vaccines being in my store or the National Strategic Cold Store does not mean anything. I can come and say I have 50 million doses of any antigen. But so long as it doesn't get there, so that's what MPCD does, getting the vaccine to the people.